The cost of the COVID-19 pandemic is staggering in lives lost and, of course, in the damage it's wreaked on the global economy. And yet the billionaire Bill Gates believes we were lucky that the virus was not even more devastating. So you would think after that experience we would be setting in place systems and procedures to track and isolate a virus before it takes hold. But the spread of monkeypox tells another story. 2 months ago, in mid-May, the UK and the US identified their first cases of the virus, and since then the case numbers have been rising in both countries. Here in the UK, more than 1,700 people have been infected. 70% of those cases are in London. 1,800 people have been recorded to have had monkeypox in the United States across 44 states. And according to America's top doctor, Anthony Fauci, that's probably understated. It needs to be taken much more seriously, he says. The worst area affected is New York, where almost 500 cases have now been recorded. Dr. Stella Safo is an HIV primary care doctor in New York City, and she is preparing for a surge in monkeypox cases. So you believe that, it is now out of control?
Yes, it's definitely getting to those levels. You know, monkeypox is the family of smallpox, and smallpox, as we all know, was eradicated. Monkeypox was one of those diseases that we only saw in areas that had kind of lower resources. So we saw them in certain parts of West Africa. The fact that it's spreading now and there's community transmission is new and different and surprising, and something that we should take pretty seriously.
When you compare it to what happened with COVID-19, do you see similarities?
There are definitely similarities in that this is a newish disease in terms of a disease that we're not used to seeing spread. Many people have never encountered it, and so we don't have natural immunity for it. And it requires a public health response to contain it. And so those are some of the similarities. There's a lot of differences, though, and the main difference is that COVID was spread very effectively through droplets, and so it's a respiratory virus, whereas monkeypox is really, it requires bodily fluids and contact to spread, so it spreads a little bit less easily.
It's really the public health response I want to focus on. Why do you think it is difficult in the United States to isolate and contain a virus when it comes into the country?
It's such a good question. You know, it was difficult before COVID. I think it's more difficult after COVID in some ways. And it's more difficult now because of the collective exhaustion for public health that I think a lot of folks are feeling. Even in my practice and with some of my patients, you know, when I'm talking to them about COVID or other, measures, they'll say, well, doc, isn't it over yet? Aren't we done with that? And so there's a collective feeling of we're past these viruses or we're past these infections. And yet we know that we're not. And so monkeypox coming at this time is really unfortunate.
But you will know as an HIV doctor that after that pandemic, in particularly in Africa, where it really took hold and was devastating to the economy, we've had lots and lots of discussions about an early warning system, about how we can educate the public, how we can isolate people and get on top of viruses. We don't seem to learn the lesson, and that's worrying, because we've been told by some very serious thinkers on this issue that the next pandemic might be even more dangerous than COVID-19.
That's exactly right. I mean, in some ways, we got a little bit lucky with COVID in that the mortality wasn't even higher than it was, and that it didn't spread even faster. I mean, now the latest kind of strains of variants of COVID are spreading incredibly fast. But at this point, most people are vaccinated. Imagine a virus that spreads super quickly and that kills, let's say, 10% of the population. The consequences are devastating. By the time you even have a hold on it, hundreds of thousands, if not millions of people in the world are gone. Monkeypox is not that virus. It is definitely harder to spread. And so we're doing the thing that we've always done, which is burying our head in the sand, minimizing our risks. So as we know, monkeypox spreads primarily through contact, and we're seeing it mainly in men who have sex with men. So a lot of folks are saying, well, that's not me, so I don't care. And that's exactly the wrong response when it comes to a public health issue, which monkeypox and all of these infections are.
Rebecca, it's definitely not the same virus, but it is a very effective test case of just how much we've not learned. And we were just saying there, just imagine if we had a virus that spread rapidly and it was killing people, and the devastation that would do to the world economy. Isn't developing an early warning system and developing a system where we all talk to one another, isn't that now a priority?
I would say absolutely yes. It started to become a part of sort of national security and international security planning. I think it's fair to say that there were these types of early warning systems in place. They just didn't warn us early enough, and there were a lot of contingency plans. There were strategies in place as well, but we didn't realise with COVID, for example, just the extent to which it would shut down the global economy and in particular supply chains. So it's a supply chain effect that was the most significant with COVID, and that was what we had to struggle to restore, and it's that we're still fighting with as well. That's what's causing some of the increases in prices that we're seeing at the moment.
Yeah, of course, your commander-in-chief, Brian, has to accept that there's a problem and has to get on top of it. Yes, he did an awful lot with the vaccines, but he principally, more than anybody else, buried his head in the sand.
We're talking about Joe Biden or Trump?
Well, I would say Donald Trump first.
Yeah. Yeah.
Wouldn't you?
No, listen, I think there's fair criticism on Trump and his reaction to COVID, but you got to balance that out against with respect to the vaccine. I mean, the vaccine that his administration pushed through and shepherded and gave them the backstop to do the magical stuff that they did, the scientific stuff that changed the world. I think he deserves a lot of credit. He's talked about the vaccine being critical. He's talked about people getting boosted, which is not what all Republicans have talked about.
No, but I suppose the point I'm making is that if the vaccines were an extraordinary achievement on both sides of the Atlantic, if we can do that, we should be able to develop a system, an early warning system for a virus such as this.
One would hope. I've seen studies before where we've had, I work in this space oddly enough, so I've seen, the worst case scenario, and it's frightening. And the reality is there's very little that can be done at the beginning stages. This thing will spread fast. You see how it spreads fast. I think the critical components are going to be a vaccine or even try to get ahead of some of these with these pre-vaccines that these vaccines that come out before some of these viruses come out. It's just a very dangerous, scary space that the government doesn't respond to, and science is always playing catch up to.
Dr. Safo, before we let you go, so tell us what you are doing with regards to monkeypox and what indeed the government is doing to get on top of it.
So, the only thing that I would add is, yes, it's a little bit fatalistic when you think about some of these new infections, but a big part of what will help is the public's response. And the public's response has to be to kind of listen to what the recommendations are and to follow them. So with COVID, it was wearing masks, staying indoors, and we just couldn't do it essentially for long enough to really keep the virus contained. What is interesting about monkeypox, again, the spread is a lot slower. And so what we're doing in New York is we've set up different points of information for folks to understand what to look for to know if they're infected. And there are many resources going out now to get everyone vaccinated. Again, vaccines are here to save us. And so the high-risk populations that are most at risk for getting monkeypox have options to get vaccinated. There are not enough vaccines out there. It's not equal among different racial groups who's getting vaccinated. And so there are some concerns, but there's a lot of work happening to get folks vaccinated and to keep folks safe.
Dr. Stella Safo, best of luck with all that work. Thank you very much for coming on the programme.
Thank you.